Retina detachment is a serious disease of the eye, one of the most serious diseases. But have you ever wondered, why does the retina detach? Today, I will try to explain you in very simple terms, why does this retina detach? What is the basic reason behind it? Hi, I'm Dr. Sumeet Agrawal. I'm a retina surgeon and you're watching Eye Health for You, where we try to bring logical, correct, ethical information about eye health in a very clear and a very simple manner. So, what is retina detachment? Retinal detachment is basically the separation of the retina from its underlying layer. The underlying layer of the retina is called the retinal pigment epithelium. So, when this RPE and the retina they separate, we call this a retinal detachment. Why does this happen? Basically, this happens because there is some fluid accumulation between the neurosensory retina and the retinal pigment epithelium. So, where does this fluid come from? So, this fluid can come from a couple of sources. The most common source of this fluid is basically the vitreous gel. What is the vitreous gel? The vitreous gel is a jelly-like substance which is present at the back part of the eye. It forms almost 80% of the volume of the eye, and it is located between the posterior surface of the lens and the anterior surface of the retina. So this entire jelly, the vitreous gel, it is more than 98% water, and this water can get behind the retina. When it gets behind the retina, it starts to separate the retina like a cleavage. It separates the retina in that plane, and when this fluid accumulates, we have a retinal detachment. Now, how does this fluid reach behind the retina? So here comes the basic reason of having a retinal detachment. It is called a retinal break. A retinal break is a discontinuity in the layers of the retina. It's a full thickness discontinuity in the layers of the retina. It means that the retina is broken. Very simply, if we state it, we can say that the retina is broken, and because there is a defect there, so the fluid which is present in front of the retina can get behind the retina because the eye is continuously moving. Whenever we move our eye, there are fluid currents which are generated in the vitreous gel, and because of these fluid currents, the fluid tends to find the path of least resistance, and then it can get behind the retina. This fluid, it can get behind the retina, but it cannot escape out because there is a valve like effect. So the fluid goes in, but it does not come out, and because of gravity, this fluid starts to slowly rise up, and because of which the retina detachment is a progressive disease. This means once the retina starts detaching, there is no condition where it can attach on its own. Very rarely, sometimes there are cases of spontaneous retinal reattachment, but they are very rare. Probably 1 in 1 lakh retina detachments will have a spontaneous attachment. So retina detachment needs intervention, because once the retina detaches, there is no way it can attach on its own. So why does this break happen? If we continue our logic, we have established that retina detaches because there is fluid. Fluid comes because there is a break in the retina. But why does this break happen? So the break can happen because of a number of reasons. Most commonly, it happens because the vitreous gel separates from the retina, mostly because of aging, and when it separates, it pulls or tugs on the retina, and this traction can tear the retina. Physically, it can tear. This kind of tear is called a horseshoe shaped tear because it looks like a U shaped horseshoe, and the flap of this horseshoe acts like a valve. So the fluid comes in but doesn't go out. So normally with aging, the vitreous gel degenerates. Because of degeneration, it becomes more liquid. And when it becomes more liquid, the fluid currents inside the eye, because of eye movements, they are enhanced, they are more strong. And because of this fluid currents, the vitreous gel slowly starts to separate from the retina. Now, there can be pre-existing weak areas in the retina also. These are called as lattice degenerations, or sometimes there can be holes also. These are called atrophic holes. So they form on their own. There is no particular reason for their development. It is just that the structure of the retina has been such that the peripheral retina can have weak areas in it. So once these weak areas undergo pull or traction by the detaching vitreous, they can give way, they can tear through, holes can form, tears can form, and this leads to retinal detachment. Another reason for this can be trauma. Because of any injury, either blunt injury or penetrating injury, the force which is generated, the shock waves which are generated, they can get concentrated on the weak area and it can cause the mechanical tear in the retina. Another reason could be certain systemic diseases like diabetes, where internally there are membranes forming over the retina. These membranes undergo contraction and they can tear the retina. So, basic reason for retina detaching is a retinal break. Once the retinal break forms, then the whole cascade of events starts, and this cascade ultimately leads to retinal detachment. Now, once the retinal detachment happens, then how do we manage it? This will be the topic of our next video. So stay tuned to our channel and you can ask all your eye related questions in the comment section. I'll try to answer them personally. I hope this video was useful to you and I wish you all the best and all the good vision. Thank you.